Hello, friends. Welcome back to a 1D10T Does Stuff, and I am the 1D10T in charge, Trevor Stewart 1308. And we are going to be talking about some distressing topics today, as usual on Tuesdays. So be aware, this is your content warning. Before we get into all of that, though, let us do today's ad read. Today's pre-rolls brought to you by The Hidden Leaf, downtown Charlottesville, Virginia, 105 West Main Street on the downtown mall. Above the bricks, Suite 200, a great place to go with some great buds to get some great buds. A bud, and the only thing better than their bud is their customer service. Also, they have the lowest prices in town, according to my own personally highly biased research, by which I mean I was incredibly high when I did my personally biased research. Obviously, I haven't smoked very much yet today, so I'm stumbling through the ad read. Don't forget to check the website for times and events, such as Frosty Fridays, where you can find our other two sponsors, Firehouse, where there's smoke, there's Firehouse, and Kush Gang, purveyor of fine edibles and drinkables. The website is thehiddenleafcville.com. That's thehiddenleafcville, all one word, .com. A note of disclaimer, we will be discussing some very serious and upsetting topics today, specifically race, redlining, and health disparities. So I will be expressing opinions. And those opinions, any opinions, not just mine, but any opinions you hear expressed herein today belong to the expressor of the opinion and or myself and or the channel and or the parent company, but not necessarily any of our advertisers, including The Hidden Leaf, Firehouse, and Kush Gang. I believe I've covered their butts there. Now, our Tuesday streams are generally, they are geared towards gaining a perspective that will help us understand the disparities in medical outcomes in marginalized people in the United States. We are specifically looking at how the medical institutions in the United States are what's the right word here? Indifferent at best and malignant at worst towards marginalized communities in the United States. Specifically because, we live here. We are also specifically looking at this with an eye to how the behavioral and mental health institutions provide a danger, put black women in danger. That is ultimately what we are looking at. Please bear with me. I am not, the brightest tool in the shed, which is why I call this An Idiot Does Stuff. So you guys are watching me try to put together thoughts in real time. So just to sort of give you guys some idea of why I struggle with finding the language or putting together the ideas. So we will be today's show is probably going to be pretty short. We will be watching Health disparities in the black community, past and present, by PBS Origins, and discussing that. No, Crystal, I did not. Before we start watching the pic of, you got a link for it? Can you give me a link to that? That sounds interesting. Pictures of Trump doing dumb stuff has been all over the news recently. So, this is not surprising to me at all. All right, here we go. Donald Trump walks past American flag that appears to be touching the ground in viral White House photos. Whoa! Whoa, that does appear to be touching the ground there. Need to know. President Trump walked past an American flag that appeared to be touching the ground as he returned to the White House on Saturday night. Title 4 of the U.S. Flag Code, Chapter 1 states the flag should never touch anything beneath it, such as the ground, floor, water, or merchandise. White House has denied that the flag was touching the ground. I mean, that's a pretty hard denial right there, eh? Dang. Just dang. You know, even if it's not the ground, it is most definitely touching flowers and plants, stuff like that, which would be still against Title 4 of the Flag Code. Dang. That's unfortunate. I mean, not surprising. Not at all surprising. The man does not have any respect for the institutions of American governance or the iconography of the American ideals, or even really any respect for American ideals. I just saying. Well, thank you, Just Me Crystal. That was fun. You know, it's stuff like that, like, yeah, I want him to be taken down by something like that. I want people to see it and go, oh, he obviously doesn't respect us. But that's not going to be the thing that does it. And honestly, I'm not sure if anything is going to make his base turn on him. The ones I want to see turn on him are the ones who are undecided. The thin margin of people who are in the middle and aren't seeing him fulfill the promises that he made, and are feeling disenfranchised by him. You know, I I know they're feeling disenfranchised by the left, by the old left, and the old left is doing everything it can to shoot itself in the foot and make itself unattractive to these people. But it's still. Anyway, you know, I think that these Epstein files, the emails, all of this ought to be gone through and paid attention to, but I don't think that these are going to be the issues, that this is going to be the issue that wins Democrats elections. The Democrats really need to focus on. Oh, no, it's okay, Crystal. It's okay. It's, it's great. A, my blood pressure doesn't really go up. B, it's important stuff to talk about, even if it's, it's important to continue to point out when he does stuff that is incongruous with presidential behavior. I think that the issue that's going to win Democrats elections is the economy. We are back to it's the economy. I think affordability is going to be what wins Democrats elections. I do think that social programs, I think if you're confidently telling everyone they're gonna get their slice of the pie, I do think you will get, and by slice of the pie, I don't mean American Dream, I mean their bit of the social programs, their bit of help. Whether that's free public transit, or rent assistance and grocery assistance. Almost everybody needs that right now. The people who don't, I'm sure, need assistance in some other kind of way. The very few people who really don't need some sort of help somehow are the ones who are worried about their names appearing in the Epstein emails or the Epstein files. That's a class-based issue. Most of us are worried about food, about gas, about housing, about holidays coming up, about, hard for me to say, Christmas presents and solstice presents. That's what most of us are worried about right now. Making ends meet. So these social issues are not going to be the election winners for Democrats that they were for JFK. That's really what they are chasing they're chasing that win, that JFK running on social issues kind of a win. And maybe they won't this time around. Maybe we will see, as we saw with the off years, maybe in the midterms, we'll see a pivot to running on kitchen table issues. We also may see the Democrats do the same dumb crap that they always do, and So away from depressing stuff to on to other depressing stuff. Health disparities in the black community, past and present. Let's see what this is.
If you've been paying attention to the news, you'll be aware that the United States healthcare system is letting down many Black Americans. But this isn't new. So today we're going to discuss historic reasons for distrust of the medical establishment in the Black community. Next, we'll tackle why these huge healthcare disparities exist. And finally, we'll address why these disparities continue to impact the Black community to this day. So this is a lot of info to cover in 10 minutes. As always, I encourage you to refer to the works cited for further reading after you're done watching. So what happens when you get sick? You call up the doctor and make an appointment, right? Well, you need enough trust in the medical establishment to feel comfortable going to the doctor in the first place. Sadly, there are famous precedents that have caused some members of the Black community to distrust the American medical establishment. That leads us to the Tuskegee syphilis experiments and the research done at Johns Hopkins on Henrietta Lacks's cancer cells. The Tuskegee study of untreated syphilis in the Negro started in 1932, when there was no treatment for syphilis. Doctors from the
Is this something that most people know about? I'm curious, is this something that a lot of, I would like to think that it's fairly commonly known about in my viewer base, because I think it's one of the highest profile examples of medical exploitation of the Black community in modern times. Although the Henrietta Lacks cell line has been talked about a lot more recently, I think. But it's, I don't even know that it was, I'm not sure when I remember learning about it. But it wasn't something that was in my consciousness until I was an adult.
The U.S. Public Health Service enrolled 600 Black men from Alabama in their study. Most of these men were sharecroppers lured by the promise of free health care. 399 had latent syphilis, 201 formed the control group. Even after penicillin began to be used to treat syphilis in 1947, these health workers only provided their subjects with aspirin, supplements, and placebos. They did not want to cure anyone. Their goal was to track the full progression of the disease. Over time, the men with syphilis became blind, went insane, spread the disease to partners, and passed it on to their kids. In the 1960s, a public health service investigator named Peter Buxton filed a protest questioning the ethics of the study. Despite this, the Public Health Service decided to carry on. Buxton leaked the story to the press, and in 1972, due to public pressure, the agency finally ended it. A year later, Congress gave a $10 million out-of-court settlement to survivors and heirs of those who had died.
I also think it's important to point out that this didn't just happen in a vacuum. The same with Henrietta Lacks. There's a long history up to that point of medical exploitation of Black bodies. And to draw the line there, to connect the dots there, that was possible, and in my opinion, a function of the othering due to, or the othering that happened in order to maintain the institution of slavery. In order to institute and maintain slavery, that othering of the black body in order to make the belief happen that black people were subjugated because it was their role in life, leads us to this ability to allow syphilis to progress in black men just to see what happens. You know, it's, and again, my background on this is, you know, are the books that we've read so far, including Fearing the Black Body, which we will get to next week. So this is, I realized that, you know, if you hear these examples, it's easy to go, oh, well, this is just a couple of incidents. You know, the plural of anecdote is not data. However, at some point, anecdotes become so numerous that they do become data. They stop being anecdotes and become data. And, you know, these are just the highest visibility examples of this. They're not the only incidents. And I think that's important to remember throughout this entire investigation. Investigation is a strong word.
It also established new guidelines that protected human subjects in government-funded public research projects. The public disclosure of the Tuskegee study led to an increase in the mistrust of the public health service and, more broadly, the American medical community. In 2016, Marcella Alsan of the Stanford Medical School and Marianne Wanamaker of the University of Tennessee tried to quantify how the experiment actually influenced health outcomes in the Black community. The researchers argue that the disclosure of the study led to fewer outpatient and inpatient physician interactions for older Black men. Their estimates suggest that life expectancy at age 45 for Black men fell by up to 1.5 years in response to the disclosure. As the Atlantic magazine reporter Van R. Newkirk II maintains, the Tuskegee study was not a singular event that was reported and processed immediately, but a generational scarring that defined a decade of Black history. Another generational scarring took place with the disclosure of how Henrietta Lacks, a Black woman with cervical cancer, was treated at Johns Hopkins University. Lacks died in 1951 at the age of 31, leaving...
So she keeps saying the disclosure. And I don't think that any communities would be healthier if they did not find out that these things happened. I think the only way that communities would be healthier is if these things did not happen. I feel like the disclosure, while information, as we've discovered in Inflamed, the anatomy of deep medicine, as we discovered in Inflamed, the anatomy of injustice and deep medicine by Raj Patel and Rupa Maria and Raj Patel. Got there again. You know, information. Getting information can damage the biome. There is, you know, external stressors don't have to be physical in order to do damage. So the disclosure of these things, that information is stress and does damage. And we see how, this woman is pointing out how that damage is also done to a generational consciousness. But I also don't think it would be. I don't think non-disclosure would be not damaging. I think non-disclosure might be more damaging in the long run. I think. I have nothing to prove this, though. I have no way of knowing. And any tests that I can think up would be unethical at the very least. Because I think that withholding information from people is generally unethical. Especially, yeah, just
behind a husband and 5
thing.
children. Her tumor cells, named HeLa cells, were used by researchers without the knowledge or consent of Lax or her family. Although the medicines developed from this research made millions for private companies, Lax's family received no financial benefit. These cases, which show examples of systematic abuse within the Black community by the medical establishment, aren't as unusual for that time period as we may at first assume. During the century following the Civil War, Jim Crow laws made racial segregation legal. These laws denied African Americans the right to vote, made it difficult for them to obtain certain kinds of employment, and created obstacles to benefits from certain educational opportunities. For more on the history of Jim Crow laws, check out our episode, The Racist Origins of U.S. Law, right here on our channel. During the Jim Crow era, white doctors could refuse to treat Black people, and in some states, white nurses were legally forbidden from taking care of Black men. At the end of the 19th century, Black Americans who wanted to become doctors usually attended a handful of Black medical colleges, including Howard University College of Medicine, founded in 1868, and Meharry Medical College, founded in 1876.
Vistaprint prints everything to get your brand in front of your fans, like t-shirts, water bottles, and totes, so everyone.
Although other options would become available at the start of the 20th century, it wasn't until the mid-20th century that higher education was forced to desegregate. In 1946, the Hill-Burton Act financed the construction of more hospitals throughout the country. This sounds great, except the Hill-Burton Act still followed the principle of separate but equal when it came to medical services. In Alabama, for example, Hill-Burton funds supported the construction of segregated hospitals in 65 out of 67 counties. In 1964, President Johnson signed the Civil Rights Act, which outlawed discrimination based on race, color, religion, sex, and national origin. Later, this act would expand to include discrimination based on sexual orientation. However, it wasn't until 1966, when the Medicare program was established, that distribution of federal funds for low-income patients was tied to whether an institution actually complied with non-discrimination and non-segregation clauses in the Civil Rights Act. The public policies and institutional practices that kept educational and medical segregation in place for so long laid the groundwork for the structural racism that carries on to this day. American housing policy provides an excellent example of how structural racism can influence health outcomes. Before the passage of the 1968 Fair Housing Act, it was legal in the US to discriminate in the sale, rental, and financing of housing. This meant that...
All right. I feel like we are finally at the bit that ties together what these last 4 weeks, what I've been trying to get at these last 4 weeks. I really didn't think that we were going to get something that tied it together, and I didn't feel like I was going to get there, but it feels like we might well be getting what I was looking for.
That people could be legally forbidden from living in certain communities. Since health is influenced by the quality of one's living environment, this put many Americans of color at a disadvantage. Even after the Fair Housing Act was passed, a kind of de facto segregation still existed in many parts of America. Some people stayed in their segregated communities, others relocated to urban centers. From 1950 to 1980, for example, the total Black population in America's urban centers increased from 6.1 million to 15.3 million. At the same time, many white Americans left the urban areas to live in suburbs. In her recent article, Michelle Gordine explains that living in urban neighborhoods can directly affect the health of African Americans. As she writes, in some neighborhoods, children might be exposed to lead paint, have limited to no access to recreation centers or parks, and be taught in overcrowded classrooms. These environmental factors can influence physical and mental health. So far, I've discussed some of the reasons that there are disparities in health outcomes, but how are these disparities tracked today? One way is via pregnancy and childbirth statistics. In September 2019, researchers from the Centers for Disease Control found that Black, American Indian, and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. More specific to the African American community, the pregnancy-related mortality ratio for Black women who had earned at least a college degree was 5.2 times that of their white counterparts. Here's another terrible statistic. According to the U.S. Department of Health and Human Services, African American infants are 2.3 times as likely to die as those born to non-Hispanic white mothers. This trend is consistent despite the mother's educational level and socioeconomic status, according to Christina Novoa and Jamila Taylor. Here, they argue that this disparity is not simply due to African American mothers' higher maternal health risk factors. It is also caused by how institutional racism and sexism compromise women's health across time. But what about now in the modern era? Why are the statistics still so dire? For the answer to this, we need to consider the concept of implicit bias. In her 2019 book, Stanford psychology professor Jennifer Eberhardt writes, implicit bias is a kind of distorting lens that's a product of both the architecture of our brain and the disparities in our society. We all have ideas about race, even the most open-minded among us. Those ideas have the power to bias our perception, our attention, our memory, and our actions, all despite our conscious awareness or deliberate intentions. To understand how implicit bias plays out in healthcare, consider the prescription of pain medication, which is essential for healing after surgery. Black Americans are prescribed less pain medication than their white counterparts. A 2013 article in the American Medical Association's Journal of Ethics suggests that this results from a large gap between the evaluation and treatment of pain in white people and its evaluation and treatment in African American and Hispanic people. Implicit bias also affects how providers diagnose and treat psychological pain. In a recent story on NPR's Morning Edition, reporter Yuki Noguchi showed that many Black patients only receive mental health treatment in spaces that she refers to as places of last resort, including jails, schools, and emergency rooms. Noguchi reports that studies show that African Americans tend to be given psychiatric diagnoses that are incorrect or especially severe or less treatable, such as schizophrenia instead of depression or bipolar disorder, and that can lead to inappropriate treatment. Noguchi quotes Dr. Alpha Stewart, the first Black president of the American Psychiatric Association, as pointing out that there is a scarcity of Black mental health professionals working in the US. She cites another medical professional, Dr. Ruth Shim, as explaining that errors in diagnosis are often being made by non-Black doctors who misread emotional cues like anger. Having access to mental health providers is even more urgent as our society responds to image after image of physical and emotional violence perpetrated against people of color. In the work cited, we have included a link to a website called Black Mental Health Matters that links to therapists, hotlines, and other organizations specifically aiming to help Black Americans.
When you download the Hardee's app and join My Rewards right now, buy 3 hand-breaded chicken tenders, get 3.
Access to a support network is especially important during the COVID-19 crisis. Black Americans are becoming infected at a much higher rate than white Americans. One report issued by the CDC in April found that a third of patients hospitalized with COVID-19 were Black, despite the fact that this group comprised only 18% of the community being evaluated. When presenting this statistic, the president of the American Medical Association, Patrice A. Harris, explained that 3 factors put the Black community at greater risk. These factors, and I'm paraphrasing a bit, include first, higher rates of certain pre-existing conditions in the group, including diabetes, hypertension, and obesity. Second, the fact that people of color form a disproportionate portion of the essential workforce outside of the health professions. And third, the existence of implicit bias and racial discrimination in our society that continue to produce structural inequities and social determinants that can lead to negative health outcomes. This trend continues. In June of 2020, NPR reported on a study issued by the Centers for Medicare and Medicaid Services that reveals that Black Americans enrolled in Medicare were hospitalized with the disease at rates nearly 4 times higher than their white counterparts. The physical and emotional strain that this higher infection rate puts on Black communities is overwhelming. As a global pandemic and assaults on people of color dominate the headlines, it is painfully clear that these failures are not a thing of the past. We need to understand the history of health disparities in America, to chronicle our experience with them in the present, to address our implicit biases, and to speak up against injustice if we are to successfully advocate for change. Feeling a little stuck inside? Then you should head over to PBS Terror to check out Joe.
So this feels like a very entry level into what we're trying to look at video. It feels like it didn't quite dig into those health disparities that come from where we live, kind of thing. Yeah. And not that it's bad. It covered that ground pretty solidly, pretty quickly, pretty well. It just didn't get in depth about anything, I feel like. There were a couple of books in there that I feel like I should probably try to get my hands on and read. And I will at some point go through the video description and see about snagging those book names and then getting those books. It is again feels like that didn't really dig into depth about any of this. It didn't really it didn't really get into depth about any of the underlying structures, which is kind of what I was hoping for. I think, again, what I've been looking for in the past 4 weeks was something that could get at the underlying connections between, the underlying connections between redlining and health disparities. And I think what we have learned over the past 4 weeks and in Inflamed is that, redlining occurred in order to corral Black people into very defined spaces that could be treated with a level of contempt. The space itself could be treated with a level of contempt and disregard that such that it has explicit health effects on the individuals living there, not just the effects of the implicit biases that ended up in this system, that created this system, but also the explicit physical, external physical threats to health, such as she briefly touched on, lead paint, all of a sudden I forgot all of what she talked about, but the environmental conditions there being such that it has an effect on its residents. Pollution, those compound the implicit actions of, or are compounded by, the implicit beliefs that come out through the actions of healthcare professionals. There at the very end, she did touch on on some of the healthcare or mental health stuff that I'm sort of trying to talk about. And I remember that NPR piece by Yuki Noguchi. And I remember listening to it thinking, oh man, I should really talk about this. I should really have a, but I didn't, I wasn't, at the time wasn't streaming, I don't think. If I was streaming, I wasn't streaming this stuff. I don't think I was streaming at the time. I think I was still doing the pre-recorded I think I was still doing... I might not have even been doing Weekly Broken News at the time. In any case, the health disparities that come from both the explicit and implicit biases and the expressions of those explicit and implicit biases. Oh, that was the other thing I wanted to sort of talk about. Is she said, she talked about pre-existing conditions such as diabetes and a couple of other things, high blood pressure, as if they're, and I don't think she meant to do this. I know she didn't mean to do this. I'm sure of it. I don't know it because I don't know this person or what's in her head. But the way it felt framed to me was that Black people just have these pre-existing conditions, and I think we have gone through enough of this in this channel to say that these aren't, Black people don't just have these pre-existing conditions. These are things that are part of the sort of the larger health I want to say exposome of black people because of the environment in which they exist. There isn't, not a doctor, but I'm pretty sure that black people don't just naturally have higher blood pressure or their pancreases work less well. I think what it is the environments, the both implicit and explicit biases of the environments put pressure on their bodies, and their bodies respond by having high blood pressure or diabetes, and part of it is their environment includes diets that are not great. Not great around things like carbohydrates, sugar, fried foods. These less than stellar diets are usually thrust upon black people. So it's not that their bodies are any different, it's that their conditions are different. These environmental conditions are such that these things seem like pre-existing conditions. You know, I think that's one of the lines that I have been trying to draw since the beginning of doing this set of videos, is that it's not that black bodies are different, it's that how they're treated is different. And that treatment has been going on for so long that it's hard for people, both inside and outside of the medical institutions, to take an honest look at the health of black people. And I think some of that is because there are aspects of the medical institutions that make money off of the system working the way it is. They continue to exist because the system is the way it is. And I think that is most prevalent in the mental and behavioral health aspects of the system. Liberty Twitcher, it's sick care, not health care. If they wanted us to be healthy, they'd help us avoid being fat, for example. Yes, thank you. Concise statement. Thank you. Yeah, exactly. That's the point. If they wanted black people to be stable, if they weren't making money off of instability, then they wouldn't cause instability. It wouldn't. And my example for this, again, it's anecdotal. Let me shout you out there real quick, Liberty Twitcher, by the way. It's when they pick up a black person who is having in emotional crisis, having a mental health care crisis, when they send the cops to pick that person up, and then they incarcerate that person in the hospital, that is not helping anything at all. That's the kind of thing that exacerbates the problem. And the original crisis was being caused by the micro and macro aggressions of racism in a liberal community. You know, if my friend had been in a conservative community, I feel like the macro racisms might have been more abundant. Even the micro racisms might have been more abundant. But they wouldn't have been as insidious. They'd be expected. If you live around a bunch of bad people, you expect them to be bad people. You know that. But in a liberal community that espouses, anti-racism, espouses equality, but then continues to behave poorly, I think that can cause more damage. Much like the, as the woman was discussing, the disclosure caused damage. That cognitive dissonance causes damage. And when it led to a breakdown of the system, in this case, when my friend had their crisis, the tools of oppression were used to subjugate the crisis. And when I put it that way, for the first time, it is very colonized. It's very, very colonized. It's, yeah. So that's sort of, I feel like that's the idea that those are the ideas that we're trying to dig into here. We're going to take a step back and read Fearing the Black Body next week. Start reading that, so that is the one book that I read that I didn't read on stream. And I do feel like it gives a really solid sort of basis for some understanding of what I'm talking about. Like I said, short stream today. Thank you everyone for being here. Thank you, Liberty Twitcher. Thank you, Just Be Crystal. Thank you, all you lurkers. Stick around for the raid. And I'll see y'all later. Now's the time on the show when I say, as they say around here, 2 up, 2 down. VA, double deuces. We're out, y'all.
This is